Professor Roth. So, let us start with the introduction. Metformin is an oral medication used for treating type 2 diabetes. The history tells us that it was derived from Galega officinalis, a plant used since the 1950s, which was later approved in the US in the year 1994. Molecular formula for metformin is C4H11N5. It is primarily used as the first line treatment for type 2 diabetes, focusing on controlling blood glucose levels. So, now let us come to the mechanism of action for metformin. It is used mainly for the liver function. Metformin reduces hepatic glucose production, aiding in fasting blood glucose control. It increases insulin sensitivity in peripheral tissue. The secondary effects is that it may reduce gastrointestinal glucose absorption, contributing to overall glycemic control. Coming to the mechanism of action, as you can see from the diagram, what can be seen is that the molecular mechanism of metformin is also not completely understood. Multiple potential mechanism action have been proposed, like how you can see that there is a sort of action potential going across in this diagram. The inhibition of mitochondrial respiratory chain, also known as complex 1, activation of AMP activated protein kinase, which is also known as AMPK, inhibition of glucagon induced elevation of cyclic adenosine monophosphate, which is also known as CAMP, with reduced activation of protein kinase, which is also known as APKA, complex 4 mediated inhibition of GPD2 variant of mitochondrial glycerol 3 phosphate dehydrogenase is used and has an effect on gut microbiota. So, from this diagram, we can also understand that metformin exerts an anorexiant effect in most people, decreasing the caloric intake. So, it does not let the weight gain for people. It is known as a kind of drug used in diabetes which would not increase the weight. It also decreases the gluconeogenesis, which is also known as glucose production in the liver. Metformin also inhibits basal secretion from the pituitary gland of growth hormone, which is how it is explained in the next slide. Now, coming to the metformin used in diabetes management, it is proven effective in reducing HbA1c, a key diabetes metric. It also does not promote weight gain, like I just mentioned, unlike some other diabetes medication. It is also linked to lower risk of diabetes related complications such as heart disease and kidney problems. Now, metformin's effect on glycemic control can be represented by the percentage reduction in HbA1c. Here's the formula how it does that. So, delta HbA1c equals minus K2 into log GL, where K2 is a constant and GL is glucose uptake. Now, because this is a biosystems presentation, let us have a look at how the modeling is more focused when it comes to metformin. In this presentation, we will be discussing about the basic modeling of metformin as well as the mathematical side modeling for metformin. As you can see in the graph, not the graph, the diagram, I apologize. What can be seen is brain, heart, lung, pancreas, GI wall, GI lumen, oral bolus, intravenous, periphery, liver, and everything. So let us go. This is a schematic diagram of the compartmental model for metformin. Let us go and dig a little bit into detail how what's going on. So the modeling of metformin in a human body follows the idea of compartment modeling of diabetic patients. Here you can see that it's a compartment based model. The human body is represented by six physiologic compartments as shown in figure. Solid lines, as you can see, the solid lines here, the one which is going from like heart and lungs to the oral bolus, the one on the upper side which is going to the brain. It shows the blood flow directions. The point dash line, the dotted line that you can see, which is going from the liver to the gut. You can also see the line which is going like in the triangular manner. That those line indicates the distribution of metformin, and the rectangular blocks represent different compartments. Muscles and body tissues are represented as a single periphery block. The gastrointestinal lumen and GI wall are lumped into the gut compartment. The model of type 2 diabetic patient also includes six similar compartments. For the glucose lowering effect of metformin, it is composed of a combination of distinct activities in three organs and tissues, including the gut, liver, and periphery. Therefore, a multi-compartmental PK model is used to describe the pharmacokinetics of metformin. Now here we have just taken a single, this is a multi-compartmental model, but these models can also vary with other functions as such. Now, after talking about the basic model, which is this, let us come to the mathematical model for metformin. As you can see in this diagram, we have stomach, intestine, how the pharmacokinetics effects of metformin work in every different organs like stomach, intestine, liver, tissue, kidney. So, mathematical modeling of pharmacokinetics of metformin has been developed into taking into the account of drug flow rate in unidirectional form. Also, metformin here acts as the substrate for the organic cation transporter, which is also known as OCTN2. How you can see it in the reaction happening in the intestine. Here, metformin plus OCTN2 gives metformin OCTN2. So it acts as the substrate in the intestine, and the mechanism follows Michaelis-Menten reaction kinetics. So the formation of metformin from metformin OCTN2 is instantaneous. It's a very instantaneous, and it facilitates phosphorylation of 5-AMP activated protein kinase mediated by its binding to the ACLC22A1 in the hepatic cells of the liver. So the diagram describes all the pharmacokinetic effects of metformin, and as you go in the other slides of the presentation, you can see the differential mass balance equation of the proposed process where T is equals to 0. Here it can be seen, and the equation continues here, which leads to the mathematical modeling for metformin. Now, let us talk something about diabetic